Miss Cison is in pain right now. Her pain's at a level 10, so we're gonna give her morphine for that pain. So the first thing I'm gonna do is go ahead and check my orders, making sure that I am giving morphine through the central line because she doesn't have a peripheral line. So we're gonna do a central line push, giving her 1 ml, 4 milligrams per 1 milliliter. And so we're gonna confirm that, and I'm gonna put on some gloves. Okay, I'm gonna make sure I have my supplies laid out. So I do have my 2 flushes, my blue sterile cap, my antiseptic cap, my morphine, blunt fill needle, 3 milliliter syringe, and alcohol swabs, and a label. So we're gonna first start off by preparing our syringe. Now that it's good to go. And I'm gonna clean my vial for about 15 seconds, maybe more, making sure that it's clean. I'm gonna draw 1 ml of air, put that into my vial. Okay, this is a one and done medication, so we are going to draw all of it. I'm gonna make sure I have my nurse witness that I withdrew all of my morphine, the waste out, and then withdrew the rest from here. And then I'm gonna have her confirm my...
Yes, that is 1 ml.
Okay.
And this is empty.
I'm gonna put my... I'm gonna put on the blue sterile cap. Take this off and dispose of it into the shark. Put my blue sterile cap on. Now I'm gonna label it 4 milligrams per 1 ml of morphine. It's gonna be pushed in the central line. Then I'm gonna date, time, and initial. I'm gonna go ahead and put it on my syringe. I'm gonna make sure I have a clean med tray with a napkin in it. Place that, place my flushes and my swab cap and more alcohol swabs and my medication. And I can throw away my trash. Take off my gloves and go to the patient's room.
Reporting. Come in.
Hello, Miss Cison. My name is Jasmine. I'm going to be your nurse today. I am going to be doing your IV site some morphine for that pain, and then we are also going to do an assessment on you, a peripheral neurovascular, just to check your pain sites and everything is okay. And then we are also going to be changing that dressing because it is time for a new dressing on that CVAD. So I'm going to wash my hands. I'm going to put on some gloves. How are we doing today?
Oh, not too bad, aside from the pain.
Painful. This morphine should help.
Oh, yes.
Okay. Can you confirm your name and your date of birth for me, please?
Chris Cison, 4/1/1975.
Okay, perfect. I'm gonna go into my EMR, make sure my patient is doing the right things today. Everything's fine. Do you have any allergies?
No, don't.
Okay, we're also going to confirm in the EMR that she does not have any allergies. So we're going to start with the assessment. So I heard that you fell off of a ladder and we're having some pain in your ankle. And we're going to go ahead and check. So what would you rate your pain at?
Oh, it's about a 10.
A 10? And where's that pain at?
It's in my right ankle.
Your right ankle? Okay. And where exactly in your right ankle?
Oh, it's just kind of the whole thing.
The whole thing? Okay. I'm looking for color, making sure they're a good color. This one's kind of purple. I'm also checking the pedal pulses, making sure they're strong and equal bilaterally. Checking the capillary refills. And then, okay, can you wiggle your toes for me? Perfect. Do you feel any numbness or tingling in either one of your ankles or your feet?
No, just the pain.
No, just the pain. Okay, we're feeling the feet, making sure that they are a good temperature, that they're not too cold, but not too hot. Okay, that morphine for that pain. Hopefully that'll work. Okay? Alrighty. So everything pain-wise looks good. Okay, because we're giving you morphine, I'm gonna go ahead and just take your respirations and then also check your O2. Okay, O2 is at a 96 and respirations are at a 22, so those look good. So, okay, we're gonna be giving you some morphine for that pain. So I'm gonna wash my hands, put on some new gloves. How are you doing?
Oh, I guess I'm okay aside from all the pain.
Hopefully this morphine will help.
Oh yeah.
Okay, and I see you have a tube going, a line. So I'm gonna go ahead, check that here in a few. Okay. Can you tell me your full name and your date of birth?
Chris Son, 4/1/1975.
Perfect. Any allergies?
No.
Okay, I'm gonna confirm that in the EMR, make sure that's right. I'm gonna scan my med. Oop. Okay. So we're giving you morphine. This is gonna go in your central line. It is 4 milligrams, and it's gonna be going in your line. Morphine can cause respiratory depression and some constipation, so you do want to look out for that. And if you're having any trouble breathing, just make sure you call us. And this should help for your pain. Can you confirm your pain level again for me?
Oh, it's a 10.
A 10? Okay, so you do qualify for morphine. So I'm going to checking her IV lines, making sure it's dripping, that it's not on the floor, not tangled up. The buttons are beeping, and everything looks good here. So now we can give you my side row. Okay. Open this up. And I'm inspecting again, making sure there's no drainage, no redness. Any tenderness going on with that IV site?
No, it's great.
No? Perfect. Okay. So I'm going to take off my cap. We're going to clean it for 15 seconds. Really scrubbing it, making sure it's clean. And then I'm gonna unclamp that. And then we already charged this in the med room. So I'm gonna take off that cap. Attach this. And we're gonna aspirate for a blood draw, which we got, and then we're going to flush all the way up. We'll flush with 9. clean again.
For 15 seconds.
And we're going to be administering the morphine. The morphine goes the rate for 5 minutes, so we're going to push about each hash mark for about 30 seconds each until we hit the end of it. So we're going to slowly push that in. Okay, I'm going to push the rest in. It's all in. Clean one more time. We'll flush one more time. This is pre-charged already, no air bubbles. So we'll do the first 2 mils the same rate as we did the morphine. So about 30 seconds each hash mark.
Slowly.
Again, pushing the rest. Okay. I want to make sure this is clamped. And then we're going to put on our antiseptic swab cap on. Everything's good. Okay. Ready? Alright, Missy Son, so your morphine's administered. So, again, if you are feeling any shortness of breath, any constipation, just let us know and we will help you out with that. So I'm going to dispose of my stuff. I'm going to go on the shirt, take off my gloves, and then I'm going to come to my EMR and document that there was nothing abnormal with the IV site, that the morphine was administered well, and I'm going to click save. Okay, now I'm going to raise up the side rope so you don't fall out. Okay, that is locked. Okay, Missy Son, so now we're going to change your dressing, so I just need you to verify your name and date of birth one more time.
Chris Season, 4/1/1975.
Perfect. And do you have any allergies, especially chlorhexidine, any cleaning agents?
No, I don't think so.
Okay, and then I'm going to confirm that in the EMR, and she doesn't. My area. Wash your hands. I'm going to put on some gloves. Okay, I'm going to move this down a little. And I'm just going to check the side, making sure there's no drainage, no redness. Does that hurt when I touch?
No.
No? Okay. So everything looks good, and we're just going to get that changed out because it needs a new dressing. So I'm going to take off my gloves. And then open it. Okay, so I have a mask for you and a mask for me, but I already have one. So now I'm going to put you on a mask. Put a mask on you. This is for your protection and my protection. I just ask that whenever doing this procedure that you don't cough or sneeze or, try talking. So just make sure your head is tilted to the side.
Okay, I'm gonna raise the side rail.
I'm gonna go into the cleaning agent again. So now I'm gonna take out my gloves. Come behind my first one. Over here. Okay. So now I'm just again inspecting visually, making sure that everything's okay. So now I'm gonna start rolling the
pressing up towards the insertion site. Okay, pull that up. Away. And then I'm visually inspecting again for any redness, drainage, swelling. Okay, so now we're gonna go again with our cleaner. Take out our gloves and then open the sterile. Okay, open my gloves. Grab my first glove. Okay, grab my second glove. Fix my fingers. Now we can begin. Move my table a little. Okay, so I'm gonna grab my chlorhexidine. I'm gonna crack that open. And now we're gonna start the site. So I'm gonna scrub for about 30 seconds. Slide down the lumen. I'm done with that. Toss that away. We would use a skin prep if we needed to, just to help with adhesive. But it looks fine, so we're not going to use it. And then now, I'm going to let that dry for about 3 minutes before I put on the dressing. And so it's dry now. So now, I want my orange little gel pad right in the middle of the insertion site. About right there. And then I'm just gonna smoothen everything out. You in any pain? No, no. Good. And I'm gonna smoothen the edges while I take this off. Okay. Now I'm gonna initial and date my dressing. Put that on there so everybody knows when the last change was. Alrighty. Take off your mask now. I'm gonna roll this up. I'm gonna get all my trash. I'm gonna raise my railing. And then I'm gonna make sure my bed is locked, that it is lowered. Okay, Miss Isan, before I go, do you need to go to the restroom? No.
Okay, are you in a comfortable position?
Oh, yes.
You have your call light in your hand, so just use that if you need it. With that dressing, just please don't try to get it wet. Don't touch it, don't mess with it. But if it does, just call us and we'll get another one on. Are you in any pain? Is that morphine kicking in?
Oh, yeah.
Yes, perfect. Okay, I'm gonna make sure you have your non-skid socks on. And you do. And make sure your room is free of clutter and everything looks good here. All right, Miss Isan, if you need anything else, just give us a call, okay?
I'll wash my hands and document anything that needs to be done. Alrighty, thank you, Miss Isan. Well, thank